from Kyushu University Hospital. Thank you very much for your kind introduction. My name is Ushiro Shin. On this valued occasion, I am representing ISchool as a board member. So on behalf of ISchool, I really appreciate for inviting ISchool in these memorable occasions. And I also work in Japan Council for Quality Healthcare, dubbed as JQ, which is a accreditation body for hospitals in my country. And it also provides projects such as reporting and learning system at the national level, which I'm in charge of, and no-fault compensation and investigation and prevention for birth injury. In other words, brain-damaged baby called cerebral palsy, because it ignites lawsuit or conflict very often in my country. And I also work as an advisor to the health minister in the Ministry of Health since 2020. I'd like to talk about international trends in healthcare quality and including safety improvement, which I experienced and I observed. In the first place, I'd like to start off with activities of ISchool. So what you see here is the ISchool's vision, mission, and action. Our vision is to be the leader of transformation in health and healthcare worldwide. Our mission is to inspire and drive improvement in health and the safety and quality of healthcare worldwide. And our action is to encourage participants or members, including you, to join us to improve your knowledge, build your network on global basis, and make your voice heard. So again, what I'd like to emphasize, we have three key words such as knowledge, network, voices. And one of the ISchool's main project is international accreditation of accreditation body. Here you see in the middle, JQ is ISchool's accreditation body as well as KOIHA of Korea. And to be honest, JQ underwent ISchool's accreditation process, accreditation survey in this July. This is the third time for renewing our accreditation status. And I am a member of accreditation committee. Tonight I will join in a web-based ISchool meeting on international accreditation. I hope the KOIHA will renew their status again and again, and another accreditation body in Korea will join us as an institutional member of ISchool to get international accreditation of ISchool. Come to think of KOIHA, they visited JQ twice, in 2016 and 2019. I said twice because I met them twice, but probably they visited us before 2016, I guess. And in the first visit, we discussed hospital accreditation and the reporting and learning system a little bit. But in the next time, in 2019, we spent much time on launching reporting and learning system in Korea. And I don't know how it is working in Korea, but I hope it is working very well. And many cases are reported to KOIHA. Another big project, annual big project of ISchool is annual conference. We are having annual conference in Brisbane this year, in October. So I hope you will join our annual conference and come and visit ISchool's conference in Brisbane. And what you see here is a very rough program of ISchool Brisbane conference. On day one, what we will talk about is person-centered care, and the climate change as well. On day 2, co-production and co-creation with the stakeholders, including patient representatives and manufacturers as well. And we have WHO session on day 2 because the, ISchool is the official partner of WHO. I will talk about it later on. And yes, we provide an education program called ISchool Fellowship. So we have a ceremony for awarding fellowship certification on day 2. And on day 3, there is a big ceremony to welcome Seoul as a member of ISchool, as a member of ISchool institutional member to host annual conference. As I said, next year, the ISchool annual conference will come to Seoul. I'm really looking forward to joining in Seoul conference because I live in the city of Fukuoka, which is close to Korean Peninsula. We go to Busan, not by air, by boat, very close. So I believe, and I'm pretty sure that I will join in Seoul conference next year. And the conference after Seoul, we'll go to Turkey, Istanbul, Turkey in 2024, and São Paulo, Brazil in 2025. So I hope Seoul will host ISchool conference again and again. JQ hosted ISchool conference in 2016, which is 6 years ago. And we have a plan to host the ISchool conference again in the near future. So as I told you, one of our important project is education. Here you see the ISchool fellowship programs, and what is taught in the program is, let me see, what is taught in ISchool fellowship program. This is sort of a keyword, current keyword on global basis. Leadership for quality and safety, person-centered care, patient safety, quality improvement, health improvement technology, external evaluation system, quality and safety in resource challenged settings for low and middle income country members, and critical crisis thinking. And as we have members from low and middle income countries, we work closely with WHO. And ISchool is an official partner of WHO. If you get into WHO homepage, you will find the name of ISchool as a list, in a list of non-state actors. Okay, I'd like to switch the subject from ISchool activity to WHO activity and relevant activities. Well, this is a slide given by WHO. WHO separate quality and safety history, promotion history, quality and safety promotion history into 4 terms. I would say that there are 3 terms and 1 watershed year in 2019. On your left, what happened in the first term, dubbed, defined as foundation period. What happened was, To Err is Human was published in 2019 in the United States, and the first WHO resolution was adopted on patient safety, and based on the resolution, first global patient safety challenge was carried out, followed by second global patient safety challenge. Each challenge has different themes, such as clean care and safe care. Safe surgery saves lives. And in the next column, defined as rejuvenation, what happened was that first Global Ministerial Patient Summit was launched in London, in the United Kingdom, followed by in Bonn, Germany. And Japan held third Global Ministerial Summit in Tokyo in 2018. And Global Patient Safety Network, which is communication of experts through email, was established in this period. And in 2019, watershed moment came. Watershed moment came. And what happened in 2019 is that patient safety was recognized as a global patient priority in second WHO resolution on global action on patient safety. And in the resolution, September 17 was adopted for World Patient Safety Day. So we have commemorated the Memorial Day for 4 times so far. And the patient safety was included in G20 agenda by Kingdom of Saudi Arabia, who chaired G20 in 2019. G20 is an economic group. It accounts for 80% of world GDP, 75% of world trade, and 60% of population. And now they have patient safety as one of the agenda of G20, thanks to the effort by Kingdom of Saudi Arabia. And now we are in on your right, now we are in the period described as a vision. And what happened is that Global Patient Safety Action Plan, which is the WHO report, was approved in WHO Assembly. And along with the plan, WHO flagship initiative, A Decade of Patient Safety, was initiated. And the 5th Ministerial Summit on Patient Safety will be held in Montreux in Switzerland next year. I truly hope that Korea will host Ministerial Summit on Patient Safety in the near future. Japan, as a past host, is a member of the steering committee of Ministerial Summit. And I joined the steering committee together with government officials. But in recent months, COVID-19 disrupted the process of steering committee. So only I am joined in steering committee. But if Korea wish to host ministerial summit in the future, please let us know. And G20 patient safety was also included in G20 agenda held in Italy. And the Global Patient Safety Collaborative, mainly promoted by United Kingdom and WHO, was also initiated. This is a history on patient safety and quality improvement described by WHO. And what you see here is the Global Patient Safety Action Plan. There are 7 pillars shown here. Number 1, policies to eliminate avoidable harm. And number 2, high reliability systems such as nuclear power plant or petroleum plant or aviation industry. And the safety of clinical processes, number 3. Number 4, patient and family engagement. Number 5, health worker education and skills and safety. Number 6, information research and risk management. Number 7, synergy, partnership, and solidarity. And each 7 pillars has 5 strategic objectives. So we have 7 by 5 equals to 35 strategic objectives. I'd like to highlight some of them. For instance, 1.4 result, safety standards, regulation, and accreditation. Here you see accreditation is highlighted in WHO report. So ISchool is now working very closely with WHO to spread the accreditation of hospital, clinic, and other organizations such as educational organization across member countries of WHO. 1.5 mentions World Patient Safety Day and Global Patient Safety Challenges. 2.1, transparency, openness, and no blame culture. 3.2, Global Patient Safety Challenge, which is medication without harm. This challenge is the third challenge of WHO, third global challenge of WHO, initiated in the second Ministerial Summit of Patient Safety held in Bonn, Germany. 3.3, infection prevention. 4.3, patient advocates and patient safety champions. As you see here, patient engagement, patient involvement, patient empowerment is a highlighted agenda, and it will continue to be one of the focused area in coming years. And 4.4, patient safety incident disclosure to victims. And 4.4 is really important, and personally, I am now promoting disclosure of incident in very honest manner, in very candid manner to patient and family in my hospital. This project is not only conducted in my hospital, but also it is carried out in the United States. The project is called CANDOR, C-A-N-D-O-R, which means honest or very faithful. It is promoted by the federal government, Federal Department of Health and Human Services of the United States, and it is also promoted by a private foundation called Patient Safety Movement Foundation in the United States. I think this will be one of the focused agenda in the near future. Okay, apart from WHO and ISchool, ISO is also an accreditation body, and together with the ISchool, ISO is now developing a new standard which is closer to the front line of medicine. I am a member of developing committee. The committee member comes from the countries with star mark. Here in Asian region, India, Taiwan, and Japan. I'm representing Japan. India, Taiwan, and Japan is joining in the committee. I hope Korean expert will join the meeting. And other keywords. The ones such as 5.2, Centers of Excellence for Patient Safety Education and Training. 6.1, Patient Safety Incident Reporting and Learning System. Incident Reporting and Learning System is probably in operation in Korea at the institutional level and the national level as well. This is a very important project which WHO intends to spread across member countries. 6.5, digital technology for patient safety, as mentioned in previous lectures in today's symposium. 7.1, stakeholders engagement, including patient and family. 7.3, patient safety networks and collaboration. As I said in the previous slide, reporting and learning system at national level is very focused area. So WHO provided education and training for Maldives government in March this year. I joined in the education course as a lecturer, and we had a very fruitful time. And I hope Maldives government will launch the similar equivalent system in the very near future. And come to think of quality and safety, it is increasingly highlighted on global basis, which is evidenced by the fact that 3 different organizations published a paper on quality and safety in 2018. Those organizations are Lancet Global Commission, and National Academy of Medicines of the United States, and the WHO, OECD, and the World Bank. As seen here, quality and safety is sort of a global issue. Okay, in this slide, I'd like to highlight reporting and learning system. In my country, JQ with government fund, initiated the reporting and learning system in 2004. So the WHO report published in 2005 included our activity, but our activity was so small then. And in 2016, I was invited to WHO expert consultation meeting, and WHO began to consider that reporting and learning system will be included in the list of main agenda of WHO to promote patient safety across member countries. So at this moment, I'd like to ask you a question. Who took the picture? It is including, I am included in the picture. Who took the picture? The answer is that Professor Sunny Lee of Ulsan University, Professor Sunny Lee of Ulsan University took the picture for me. And next question is, who took the picture of him? I took the picture. So Professor Sunny Lee participated in many international occasions. I met him many times. So we are very good friends, exchanging our knowledge and expertises, and taking photo of each other. And in my understanding, in my knowledge, he is now on sabbatical leave, and he's now working in national insurance organizations. And come to think of Korean National Insurance Organization, I know that it's running a hospital called Ilsan Hospital. Ilsan Hospital visited my university in 2016, and I met the delegation of Ilsan Hospital. I remember them very well. And the delegation of Ilsan Hospital was led by Dr. Kim Song-woo. And recently, I learned that Dr. Kim Song-woo has promoted to the director, CEO of the hospital. So congratulations. 축하합니다. And WHO revised report on reporting and learning system in 2020. It included our contributions. And I described on those occasions our activity on reporting and learning system at the national level. Here you see the reporting and learning system on, through web-based technology in operation in my country. It's very successful, and we have seen record number of reported cases year by year so far. So we thought that national reporting and learning system is well accepted in Japanese, not only in Japanese medical society, but also in Japanese general society. So we launched the equivalent system for medication safety in a community pharmacy. It was launched in 2008. Yes, and the next year, we have a plan to launch another equivalent system for patient safety in dental clinic. With those achievements and experiences, I was invited to WHO webinar series to describe our reporting and learning system. Okay, next global move, global trend is World Patient Safety Day. So far, we have observed four World Patient Safety Day with different themes, such as Speak Up for Patient Safety for the very first year, Health Worker Safety, and Safe Maternal and Newborn Care. And this year, we have Medication Safety as a theme of World Patient Safety Day. And in the very first year, this is a group photo of National University Alliance on Patient Safety. We took a group photo, and we raised up a logo of WHO, and we have things in orange. So we commemorated the day in this way or another. So, as I mentioned earlier, the Global Ministerial Summit on Patient Safety is now underway, and it will be held in Switzerland next year so please join the Ministerial Summit next year in Switzerland. And the hosting company moves around the world. It was held in UK and Germany in Europe, and Japan in Asia, and Saudi Arabia in Middle East, and it will come back to Europe in Switzerland. But for the next host, we are thinking of having African countries. I don't know if we can do that, but we are thinking of that. And after that, we are planning to have hosting company in North America or Latin America or Asian countries. So I'm really expecting Korea to be a hosting company in the near future. So this is a photo taken on occasion of 4th Ministerial Summit in Jeddah, Saudi Arabia. I met Korean Health Minister, Mr. Park Nong-hoo, and on a small bus heading for this building, the health minister looked a little bit isolated. So I talked with him with my very poor Korean language, such as 저는 Ushiro Shin 라고 합니다. 좀 뵙겠습니다. And 일본이 왔습니다. And we had a very good time exchanging our views. And on the second day of Jeddah Summit, Jeddah Declaration was issued, including number 5, implementation and sustainment of national reporting and learning system for patient safety. As you see here, reporting and learning system is highlighted in Middle East countries as well. Okay, next, the activity by G20. Okay, this is a picture taken by Sang-il Lee, Professor Sang-il Lee. He was sitting opposite of my table. And G20 is now very interested in having patient safety as one of the agenda. So in 2020, G20 issued health minister's statement. It includes the establishment of a new group on patient safety promotion. It is called the Global Patient Safety Leaders Group. As COVID disrupted many things, but this meeting, a new leaders group, was held in July 4th this year, and Korea was well represented by Dr. Ho Kim-yoon on behalf of KOSQA, Korean Society for Quality and Healthcare. So I was really happy to meet a Korean expert. So I'm really looking forward to working with him in ISchool's framework, G20's framework. So last but not the least, I'd like to highlight maternal safety. Maternal safety, as I mentioned earlier in my talk, JQ provide no-fault compensation for brain-damaged baby called cerebral palsy. Cerebral palsy is a hot issue currently in the United Kingdom. United Kingdom is suffering from skyrocketing damage payment for cerebral palsy and the conflict between medical professionals and families. So what we do in our system is to provide no-fault compensation, and we published investigative report delivered to families and childbirth facilities, and we published prevention report to spread across OBGY societies, and we have observed quality improvement in terms of specific procedures such as fetal heart rate monitoring, administration of uterine contracting agent like oxytocin, and mechanical ventilation for the neonate. And more importantly, we have observed a rapid decline of lawsuit case related to OBGY in my country. So this year, in January, I was invited to to the Committee on Health and Social Care of the House of Commons of UK Parliament, together with international experts from New Zealand on your left and Sweden in the middle, and the state of Virginia of the United States on your right. And I described our system. And I submitted our data, and it is included in the report, official report of the committee. Okay, there are some takeaways to share with you. Number one, ISchool is an international organization that provides accreditation education conference to gain knowledge, expert networking, etc. Please join us on occasion of 2023 ISchool conference in Seoul. Global trend is, for example, represented by WHO Global Patient Safety Action Plan. It highlights 35 strategic objectives such as World Patient Safety Day, patient-family engagement, reporting and learning system, patient safety networks and collaboration, etc. Such international groups and alliances as G7, G20, Ministerial Summit Series, Islamic World Alliance, ISchool, ISchool are in operation, suggesting quality and safety improvement is a global agenda. Obviously, Korea plays a vital role together with us in building and promoting the trend. We are looking forward to working with you. Thank you very much. 매우 감사합니다.